The head is a ball-like structure found at the proximal end. If you see closely, it is nearly hemispherical, making almost 1/3 of the sphere. If you remember correctly, this part is where the humerus is attached to the scapula via the glenohumeral joint. The head faces medially, upwards, and backwards towards the body. Below the head, we have two important bony landmarks, the greater tuberosity and the lesser tuberosity. Lodging in between is a groove known as intertubercular groove or bicipital sulcus. It gets its name as the bicipital tendon is located here. Now, if you rotate the head of the humerus, you would just observe that it has the shape of a lip that gives it a medial and a lateral lip, as you can appreciate over here. Now, this head is separated from the greater and the lesser tubercles by an anatomical neck. The anatomical neck is obliquely directed to form an obtuse angle with the body of the humerus. Capsular ligaments gets attached to the anatomical neck except inferiorly. The surgical neck runs from just distal to the tubercles to the shaft of the humerus. The axillary and the circumflex humeral vessels lie against the bone here. Injury at this part may lead to fractures due to a direct fall onto the arm or due to the trauma. This may cause axillary nerve damage in such patients. The axillary and the circumflex humeral vessels lie against the bone here. Injury at this part may lead to fractures due to a direct fall onto the arm and due to trauma. This may cause axillary nerve damage in such patients. The surgical neck runs from just distal to the tubercles to the shaft of the humerus. The morphological neck is a junction between the epiphysis and the diaphysis. It is a true junction between the head and the shaft. Let's have a run through. We have the ball and the neck, the anatomical one, the morphological, and the surgical neck of the humerus.